About
280.
18+% of our children right now are obese.
This could be the number one issue, both in terms of human misery, the severity of the disorders that are consequent to it, and at the cost of this enormous problem, which is only going to get bigger.
As obesity will soon pass smoking as the number one avoidable cause of death among Americans.
Americans are eating a lot differently than they were a generation ago, not just in terms of what we're eating, but how we're eating.
Diabetes, stroke, cardiovascular disease, cancer.
Someone who's obese costs on average more than $1,400 to care for more per year than someone who's not obese. Someone with diabetes costs on average $6,600 more to care for per year than someone without diabetes. Collectively, obesity costs about $150 billion a year.
The United States is the world's fattest developed nation, with an obesity rate double of that in many European countries. 1 in 3 Americans is expected to have diabetes.
Children we see here, children's diets and the calories that are coming from carbohydrates. You can see here fat, protein, carbs, and then how that breaks down.
It's been estimated that the typical American gets about 350 calories a day from added sugar, and the American Heart Association has said that needs to come way down.
Obesity rates have been going up very rapidly in the United States, but really only since about 1980. Before that, they were constant for decades. A change in the way our federal agriculture policy worked, which went from paying farmers not to grow food to paying farmers to grow as much food as they possibly could. And the result of that was an enormous increase in the amount of food available in the country for consumption.
Portion sizes went up as well. Fast food servings are 2 to 5 times what they used to be.
Your mother gives you $5. You want to make that stretch, you understand? You're going to McDonald's, you're getting a McDouble, and you're getting you some fries. And then you're going to go to the store and get you something to drink. And that way you still have at least $1 or $2 to maybe buy you some chips a little later.
2 out of every 3 food stores in Harlem is what's known as a bodega. Now, these aren't grocery stores. They're more like corner convenience stores. So rather than having fresh meat and fresh vegetables, they tend to have a lot of processed foods, sugary foods, and especially sodas. The city of New York has identified sodas and other sugar-sweetened beverages as one of the main causes of obesity.
The facts are, quite frankly, frightening. Obesity-related disease kills 400,000 Americans each year. Medical treatment of obesity and its more than 24 associated conditions costs nearly $100 billion annually, according to some estimates, with about half paid by taxpayers through Medicare and Medicaid. In 2001, obesity was a primary factor in 5 of the 6 leading causes of death among Americans: heart disease, cancer, stroke, chronic obstructive pulmonary disease, and diabetes.
Here in Mississippi is that most parents of obese kids don't realize that their kids are obese. In fact, despite the recent improvement, 41% of public school kids are either overweight or obese. Yet only 15% of parents say their kids are overweight or obese.
Perception does not equal reality at all.
Nutritionist Catherine Brooking says many Americans are confused about what healthy eating really means.
People want to be healthy. People want to do the right thing, and they don't want to admit how bad things have become.
85% of Americans rarely, if ever, count calories. Another 79% never set foot on a scale.
I don't care about calories at all. I eat when I can.
Maybe that explains why only 11% of those surveyed say they are very overweight or obese, when the truth is 26% of Americans are.
that it costs a lot of money to treat obesity. It's been said that about 70% of spending of healthcare dollars comes treating people that have chronic diseases. And many of these chronic diseases are the lifestyle diseases. So we're talking about heart disease, we're talking about type 2 diabetes, and those are all the diseases that can be prevented or treated better with better lifestyle.
Foster access to fresh foods. Studies show that neighborhoods with high access to grocery stores and low density of fast food chains have the lowest obesity rates.
Programs that have focused on better eating in school, more exercise. This time around, the researchers and the policymakers sort of said, you know, instead of being so prescriptive or qualitative, we're going to focus on patterns of eating. We want this to be simple for people.
When children have access to safe public parks and recreational programs, studies show their body mass index numbers drop significantly. Proper education and nutrition could reduce obesity enough to save an estimated $4 to $10 billion in healthcare over the next decade.